It's absolutely vital that young people make good decisions on the roads, whether you're a driver or a passenger. One poor decision, one error of judgment can affect your life, parents' lives, and the lives of many other people for years and years to come. My name's David Eddy. I'm an emergency physician at University Hospital Geelong, and I lost my brother to road trauma on the eve of my 18th birthday. He'd been out playing sport with mates, and unfortunately the driver in the vehicle he was travelling home with was intoxicated and ran off the road into a river where my brother drowned. And I remember footsteps on the driveway thinking it was my brother coming home, but there was a knock on the door and there were two policemen there. I remember their words, I remember my mother sobbing, and I remember seeing my father cry for the first time. Something I will never forget.
Geelong Emergency, it's Damien speaking.
Before a road trauma victim arrives, the emergency department receives a phone call on our BAT phone from the ambulance controllers advising us of an imminent arrival of a trauma patient. The emergency department usually has an opportunity to prepare itself and assemble a team of doctors and nurses and other specialists. This includes senior emergency physicians, emergency registrars, senior emergency nurses, and specialists from surgery and anaesthetics. The state of mind of emergency department staff as they prepare to treat a trauma patient is often a mixture of anticipation and sometimes dread.
Okay guys, so this is Jake. Jake's 20. He's been the front seat passenger in a small sedan that's been travelling at 100 kilometres an hour on the Barwon Heads Road.
The immediate priorities of managing a trauma patient when they arrive in emergency is to make sure that their airway is clear, that they're breathing and that their lungs are working properly and that their circulation is adequate.
CS is 6. His heart rate was 145, his blood pressure initially 80 on 60, sats were 80% on a non-rebreather, with freezing-induced air entry over the right side of the chest.
During the initial phases of resuscitation, when things can seem chaotic, it's important that staff concentrate and focus on their roles, which is why we have a senior clinician and or surgeon in charge of the resuscitation and making decisions. This enables people to concentrate on their individual tasks without getting distracted by the overall severity of the case in hand.
Arrested. Okay. Have we got some to light? So 28, 29, 30.
Hello, my name's Rhoda. I'm one of the
Who's
nursing
this?
staff here in Geelong. We have Jack here, and it would be really good if you come in to see him right now. I can't tell you any more at this stage, but we really need you to come into hospital and see Jack.
I'm coming.
Oxygen away, please. Oxygen away.
Okay.
Continue compressions. All hands away from the patient. Checking rhythm, stepping away. Do you agree that this is a non-shockable rhythm? Okay, jump. Continue CPR, please.
Checking for a pulse. Pulse return.
Okay, so stop CPR. We've got a return of circulation, and then we'll take him to CT. We need to get to the CT scanner urgently.
Jack!
Hang on a minute.
When a family member arrives, it's often in the midst of a resuscitation. Emotions sometimes become more involved, particularly when patients' relatives see the patient. Seeing their responses whilst we're trying to resuscitate a patient can be distressing.
Get you to come and stay with me. We'll stay here until he comes back. He's coming back here, okay?
Yeah.
Scans are required in the management of a trauma patient after the initial resuscitation and stabilisation of the patient. They usually involve a almost head-to-toe scan of the patient looking for evidence of injuries to their head, neck, inside their chest, their heart, their lungs, and inside their abdomen, in particular their bowel, their liver, their spleen, their kidneys, which are often damaged in major trauma. Scans may reveal severe injuries to the brain or spinal cord or internal organs that are clearly not survivable. Until this is decided, the patient is continued resuscitation on all levels. When dealing with trauma in Geelong, there are a number of tough decisions that clinicians are faced with. These range from whether or not to keep the patient in Geelong and try and save their life by urgent operation in our theatres, or to transfer an unstable and potentially dying patient in a helicopter to a trauma centre.
Patients in VF. Okay. Start CPR.
25, 26, 27, 28, 29, 30.
The other tough decisions are when to stop. When it is clear that the patient is not going to survive no matter what we do, we generally have a discussion amongst the senior doctors as to when to stop.
Just continue CPR until we bring his mother in. Okay? Thanks, guys.
Okay. I'll come around and swap out.
25, 26, 27, 28, 29, 30.
The emergency department nurses and doctors go to work knowing they may encounter serious illness or injury in any one of their shifts. We do it because we become good at dealing with it and expert at managing all the complications and other problems that arise out of a major trauma. In the end, we would like to think that we make a difference in patients who survive and even to the relatives of the patient that don't.
Oxygen away. Compressions continue. I am charging. Susan, if you can just step back, please. Yeah. Shocking. Sorry, can I just do it again? And okay. CPR continue. Susan, just step away for a moment. Laura, do you agree that's VF? Okay. Shocking. Back on, please. Please check.
Okay, team.
I think, Rona, we might stop.
Oh, please.
When we're faced with a trauma resuscitation that is unsuccessful, it is a very sad occasion. Staff often feel empathy for the patient and their relatives. Staff often question their own performance and their own decision making. And some staff require to take a time out to settle their own emotions. I think the overwhelming feeling amongst staff when losing a trauma patient is the sense of waste. The impact of my brother's death on my family is hard to estimate. For years, people grieve. We never forget him. My parents, they still grieve for him. We think of him every day. It's something that you never get over. As a parent myself, I cannot imagine losing a child to trauma. It's bad enough losing a brother. So my message to young drivers just starting out is that you just never know when your next decision may change your life or someone else's forever.